All right, a very good morning to you, ladies and gentlemen, and welcome to the ParentCraft Workshop organized by Dr. Rosan Zaid. And today's theme is a new baby is like the beginning of all things. Wonder, hope, and dream of possibilities. Well, first and foremost, I would like to tell that though this is like going as a workshop, ladies and gentlemen, feel free, relax, because just consider that this is your second home today. And if you are feeling hungry or you're tired, you're always free to walk out. The prayer room is down the IV room, and also we have the washrooms arranged for you on this right corner. And as well as if there's anything, if you have any questions, please do raise your hand. And if there are any language barriers, please do raise your hand, because we all can communicate in all three languages, similar English as well as Tamil. So make sure that we take the maximum out today. And today's program consists of Baby and Me, the antenatal session by our own renowned consultant obstetrician and gynecologist Dr. Rosan Zaid, as well as we have the nutrition during and after pregnancy by one of the renowned dietitians. And also we have breastfeeding on newborn, and also about breastfeeding and lactation, there are hints and tips, as well as labor and beyond, postnatal, and finally how to be a fit and healthy and happy mom. So today's program outlines everything that you need to know, making you prepare for that beautiful day that is about to come and making your days of life brighter. So what I want is make sure that you all are relaxed and always make sure that you are open. Don't keep your mouth shut. Like, if there's anything, just raise your hand and ask anything. I'll be coming rushing to you with the mic. So we are all one family today with this workshop. And it's time that I introduce our personality who's behind this program. She has over 2 decades of expertise in caring for women's health. And also she's registered in the United Kingdom's Medical Council, Sri Lanka Medical Council, as well as the Medical Council of Maldives. And also she's registered in the United Kingdom's Specialist Register. And also she has published career-defining publications throughout. And also she is one of the most renowned gynecologists and obstetricians, more like a celebrity in Sri Lanka. And ladies and gentlemen, not beyond that, that is her professional life, but she's a loving wife, a caring super mom, and also one of the best healthcare personality that any pregnant mother could have. Ladies and gentlemen, without ado, let me welcome Dr. Ms. Roshan Zaid. Bless you all.
Thank you very much, Roshan. Thank you for the introduction too. I think this program has been postponed so many times. I have some of my people in front who I can name who will say, my God, doctor, no matter what happens, whether petrol or no petrol, COVID or no COVID, we will still come. So I think that is the only motivation I had to carry on with this program, and today I'm so happy to see so many of you. I don't know how on earth you have made it, but you made it. Thank you very much for that. So inshallah we'll start off. Like he said, I personally know a few of you who will not understand Tamil or Sinhala and only English, and some people might not exactly. If there's a problem, like he said, any problem that you did not understand, or if I'm too fast, you can always stop and ask. And I will not talk alone at all because I know most of your names. So I will ask questions. So I have put the heading, my son just asked me, why does it have to be your within inverted commas and you within inverted commas? So the only reason being, it's not just you. You would always think, or couples, lots of couples think it's just us being pregnant. Believe me, it's not just you. It's you, it's your parents, it's your in-laws, it's your work people, it's your maid, everyone is pregnant with you. You will know why in a minute. But almost everybody is pregnant when a couple is pregnant. It's just, you're never alone pregnant. You can never go through pregnancy alone. You're pregnant means I'm pregnant too. The things that you come and tell me, it hurts me too sometimes. And I see you walk and wobble and do everything. So it's a relationship we build between all these dots. That is you, your husband, your existing children, your parents, your in-laws, your friends, even your neighbors, your everyone. So this whole program is designed because you need to understand what is going to happen. What's going to happen to you? What's going to happen to your body? How would your baby grow? What changes you would go through as a couple, as an individual? And even to support each other, you need to understand each other first. Then only you can support each other to say, okay, darling, I do understand what you are going through. If you don't know, then you would think, oh my God, she's changed. But then there are reasons for the change. So if we go through, as I told you, the understanding, it has to be you first to understand, accept that you are pregnant. Because every one of you will start this pregnancy journey very differently. Especially in this era, everybody is stressed. Some will come and tell me, happily I'm pregnant. Some comes and tell me, Allah, doctor, I didn't want to fall pregnant because of all the stresses and financial crisis and everything. I have husbands who will come and tell me, doctor, salli nahi, budget because everything is so much increased. Even if I ask when are you going to have your second baby, they say, doctor, not now, maybe in 5 to 6 years, when things change. So there are lots of things apart from just being pregnant around you, which dictates the way you behave and dictates the way your pregnancy goes through. Lots of my patients are not sleeping, they are just too stressed because of the other issues, not because of pregnancy. You all are happy that you are pregnant, but thinking of your husband's job, thinking of your financial status, thinking of the country, the schools, the food, the petrol, I can give you loads, but still that's the era we live in. So we need to understand what you're going to go through as a couple so you can deal with it in a way that your pregnancy will go much smoothly. So you need to understand everything. First, my patients come and ask me, or I get a text from someone who will say, doctor, do you think you will suit us? That indicated me that's true. Because sometimes you have expectations from your doctor. So you, apart from understanding all these, your friends, your family, everything, you have to have an understanding with your consultant, even with your midwife, to know, does this person suit me? Does this person's personality suits me? Does her beliefs and her principles, his understanding, his way of talking, does it suit me? Because some couples come and say, doctor, I just come here every month just to talk to you, just to see my baby and go home. But different people are very different. So you need to know whether your obstetrician suits you, because you have all the right to choose who you want. You can choose anyone you want, whether it's a male, whether it's a female. Because some people come and tell me, especially these last couple of months, doctor, I want a non-medicated natural labor. So obviously she has gone to many doctors and she came and told me, doctor, no one understood what I wanted. But this is what I want. Would you support me? So that is something you all have to think. What is it you really want in your journey of pregnancy? And would I be able to, or would your consultant be able to support you, respect you for the wishes you have? Some people don't want instrumental delivery. Some people don't want cesarean. Some people don't want normal delivery. So all these little things matter a lot, because you're going to go through one unique labor experience where it will be your dream. How many babies you have, whether you have 10, 5, doesn't matter. Every pregnancy is unique on its own. Every single journey you go through will be a unique thing on its own. So like I was telling you, you are going to prepare everyone. Number one, your husband. Yes, he has to be ready. What is he going to do with you when you change as a woman who's pregnant? A woman who's going to start vomiting, who's going to be angry for no reason. I can see some husbands are smiling slowly. Some will be so irritated all the time. Some are puking all the time. The ones I have, the recent ones I have, I don't want to say, I told them I will tell this. So the moment she tells me, doctor, if he opens his mouth, I start vomiting. So you imagine his plight. He can't come close. She's vomiting. She can't, because the smell is so bad. That's what she said. Then he said, doctor, I have a bath every day. I said, it's not about your bathing. It's about the changes she goes through. Because she doesn't vomit otherwise at all. Only when he opens her mouth and comes closer, she vomits. So it's like you will see very funny things. Yes, they are funny, but again, you need to understand. It doesn't mean she doesn't love you. She loves you. But the only thing is, it's different. Now she thinks she doesn't want you. The smell doesn't attract her, whatever. There's something different. But if you don't understand, it's a problem. Then he started laughing. So it's like all these little changes you will have. You will go through many, many changes. So you need to prepare your husband and yourself. Because you need to accept, no, I am pregnant. So when I am pregnant, things will change. I will be different. I will put on weight. I will not be able to run around like before. I might not eat like before. I might vomit more. So all these things you need to accept. When you don't accept, it's very difficult. Because sometimes I get women calling me and say, doctor, what is the term she said? That's what she said. So she's about 28 weeks and she said, doctor, the whole body is hurting and I think my tummy is going to burst. That's what she described. But what she meant is her pelvic pain. So her pelvic pain is so bad, she doesn't even know what to expect and she thinks everything's going to last. Okay, this is normal. Yeah, I'm in pain, but still I'm normal because I'm pregnant. So things like that. Your children, if you have at home, have to prepare them. I always tell, if you have other kids at home, you need to bring them to clinic. They need to be prepared too, because they need to know, okay, there's a new person coming in. There's a new brother or sister coming to our family. So my place as the first child in the house will change. Because if you don't, and they also have expectations, no, I want a brother, I want a sister, I want a dark sister. Everyone has expectations. I had a little fellow of 7-year-old. He came and told me he's dark, his daddy is dark, but his mummy is fair. So his only request was, I want a sister who's dark like me. If it's not dark, you can take it. I don't want a sister. So everybody has expectations. Though they are small, they buy things, they sometimes even have names. So they need to be in par with what is happening with the two of you. Especially if you have other kids, and some of them are not prepared at all. Suddenly one day you go and say, this is your new brother. It's a shock for them too. Because then suddenly you're going to spend more time with the baby. You would not look after him or her, and then he gets problems. I've had my own patient would come and tell me, doctor, the little boy who we delivered a year ago, then he came and said, he doesn't talk to anyone in the house anymore. Not to parents, not to his mama, nobody. He only talks to me because he knows as a new person and everybody is only looking after the little one. So for him, maybe he's his best friend now. And he didn't want to play, he didn't want anything, so he changed. But those you can avoid when you always interact them and mix them and mingle them, bring them along and say, this is your baby coming, this is what's going to happen. So you have to prepare everyone. So including your grandparents, your parents at home, grandparents, because sometimes what happens, they will be your caretakers for your babies. So you need to prepare them to say, Mommy, this is baby number 1 and we have to go to work, you're going to look after. Sometimes grandparents come and tell me, doctor, 2, 3, I can't handle, I can only handle 1 at home. So you need to prepare them mentally, physically to say, yeah, this can happen. Even if you have maids at home, everyone, even your office mates, there'll be days you won't go to work because you're vomiting or you're late because you're too tired to go to work. So they have to catch up your work. So there are lots of things. That's why I said it's never you alone. It's never. It's always there are lots of people with you. Sometimes you need to take a break, sometimes you can't work, you might take a day off, somebody is going to catch up your work. So you need that help with every single person that is connected with you. So you're going to prepare everyone. Who massages their wives? I always ask this. Every single class I have, I will always ask, who's massaging their wives? Kaurut nadda? 1, 2, all, my God. So that is again, it's a support. It's not only a support on its own. You are being part of it. You are there with her for the 10 minutes, 15 minutes you are together. You are making her feel more relaxed. You are being supportive. You are spending time. Most husbands will come home late in the evening after work. If they are working, and then when you come home, you're so tired. But still spend that little time. Even if you don't massage, even if you just touch her, doesn't matter. But that little time matters because it's your time. You're spending that time with her in order to spend time. You talk to her, relax her. And even vice versa. I get wives who say, Ayo, doctor, he comes home, I have to massage him until he sleeps. He doesn't massage me. So it's always like that. But at least there has to be support in every sense. Make your kids understand, if you have children, that you are not the same running mother like before. You have to slow down. You can't run like before. Everything do change. So because of all these only we thought, okay, my topics will be today how you get pregnant, what happens when you are pregnant, how does your baby grow, what changes you would go through, and then obviously labor and things after the break, I think. So would you consider pregnancy as a natural thing? How many people at home would advise you, don't go on no two-wheelers, don't climb stairs, don't bend down? All advice given by everyone. Yes? Don't eat, durian, don't eat prawns, don't eat crabs. What else? There's a lot more. Yes? So it's like, and I have some who will not even climb a stair, they will always take a lift, they don't walk, they don't even want to bend down because they are told that something will go wrong. If you bend down, your baby is squashed. So don't bend down. You can't climb stairs. If you go on a tuk-tuk, your baby will jump and come out. I have all stories. So all these are things that people tell you because one, obviously they love you. That's a different thing. But there's no truth in it. That is what you need to understand. So there's nothing called you should be happily pregnant. You're healthy. All of you are healthy and pregnant. None of you are sick. So the good thing about all my patients, I don't have sick patients at all because everybody is just happy and pregnant and healthy. So it should be like that. It should be a natural thing. Whatever you would normally do. If you go to gym, you go to gym as you always go. If you go for walking, you still continue. If you go to let's say Zumba class, go. If you go for swimming, you go. You or ride a bicycle, go and ride a bicycle. Nothing is ever gonna touch your baby. You have to understand that. Your baby is in the most safest place in entire universe. Nothing's gonna go there and do just because you climb on a tuk-tuk or go ride a bicycle with your husband, nothing's gonna happen. So you have to think there's nothing. Because I know, like I told you, everybody starts off very different. So when you have had previous miscarriages or previous bad experience, yeah, I know you will be scared. But there's nothing to say just because you climbed a tuk-tuk, just because you did Zumba class or you jumped up and down or you climbed stairs, you had a miscarriage. There's nothing like that. If something's meant to happen in your pregnancy, it anyway will happen no matter what you do. Even if you're in bed for 24 hours, doesn't make a difference. So pregnancy is as natural as it can be. So you should always think it's a natural thing. I am happily pregnant. Yes, you will have aches and pains and everything, but still you're normal. Still everything that you have is natural. And always I would say, like I told you, every pregnancy is unique. Never compare each other's pregnancy, even your own one. Because some come and tell me, Doctor, last pregnancy I was climbing up the ladder and I was cleaning the roof, I did that, I did my curtains, I went everywhere, I was so active. But look at me, Doctor, this pregnancy I can't do anything. So you don't compare anything at all. Your first pregnancy, second pregnancy, somebody else's pregnancy has nothing to do with your pregnancy. Your pregnancy is unique for the two of you. You always think it's just a unique journey. You will continue to see what happens at the end. So some of you would start your journey as a first time mommy. You would have got married like most of my patients, couple of months, 2 months, 3 months, and you are pregnant and you are excited and you come and see me. Some of you would be, let's say 1 year, 2 years, you would try and you would fall pregnant and I'll see you. Some would have gone through lots of problems. You would have had fertility treatment, you would have had injections, you would have had scans, some even IUI, IVF, failed IUI, failed IVF, and you would come to that point of being pregnant. Some of you would have had a previous miscarriage, some of you would have lost a baby. So there are lots of you with different starting points. So none of your pregnancies can ever be the same. None of will ever be there. So always remember, your journey is unique for the two of you. Take it and start it as it comes. So you will always think this is how we are going to start. Some patients who would come and tell me who even contemplated of terminating their pregnancy because they didn't want to have a baby. And then they decide, no, we will continue. So their mindset is very different to someone who always wants to have a baby. So all this will dictate how your pregnancy is going to go. How you would accept the things that are going to happen, how you will face labor, how much you both will get closer or farther. Because all this will change, everything will change. Some of you would think, this is going to budge on my budget now. Will I be able to handle this? Every one of you will have so many things in your background. So never ever compare your journey with someone else. But the journey should be such that it will make you stronger at the end, so that it doesn't break you. Because I very rarely get couples, like I would see you, I would see them through and suddenly halfway through I will not see a husband. She'll be all alone with the mother. I have patients like that, a few, which makes my heart break. Simple reason is, one is they are not ready. So some husbands, especially after treatment, I do treatment, IUI, IVF, and they fall pregnant, and even after twins. One day I would say, and I said, where is he? Then he said, no, it's too stressful for him. He couldn't take it anymore. So he's just lost halfway through the journey. So she's just left alone with the mother and her parents because there's no one else, because he was never ready. They wanted to have a baby so badly, but they were never mentally prepared for it. They were never prepared truly to say, I will take the responsibilities and the trouble a lot. So you need to accept it, that things will change. You have to be ready, the two of you. So all these little changes, not little, sometimes they are big changes, but still, I have ones who would fight non-stop throughout the pregnancy because they can't handle each other. He thinks she's irritating her and she thinks he's irritating her, and they fight. But at the end, they patch up, and I see them after I deliver in 2 weeks or 3 weeks, happy couple back again. Same couple sometimes never come back because they just couldn't take it, they do the same thing. So once you don't understand each other, once you're not ready, no one else can help you because everyone else will look up to you and say, what are you all doing? First you need to be happy, you need to love each other to carry on with your pregnancy. The moment you start finding fault on each other and you're just separating on your own ways, it's very difficult for any outsider to come and do it. So pregnancy journey is a very unique journey. It's different for every single one of you. So I think this is how you fall pregnant. So that is what I have in my next few slides. So how the pregnancy actually starts. So it always starts with a sperm and it starts with an egg. So the first picture is where the big round is the egg and the little tiny people are the sperms. So as soon as the pregnancy happens, you can see that's the second picture. So this is the first one where the egg is fertilized by sperm. So you have millions and millions and millions of sperms, but only one will always fertilize your egg. Once the fertilization happens, so it happens in the fallopian tube. From the fallopian tube, it will roll down into your uterine cavity, and it goes into your uterine mucosa and it embeds, and that is how your pregnancy will begin. So this is where your little person, the moment we see them on scan, on how many weeks do you see heartbeats? Have all of you heard your baby's heartbeats? All of you. So how many weeks does it start normally? Any guesses? 8 to 10. Anyone else? 8? How many weeks does it start? 5? Anyone else? So normally by 4 weeks. So from 4 weeks onwards, when I scan, there will be a tiny sac with a little flicker. So this is where the heartbeat starts. And I done it, heartbeat. So this is how everyone waits until they hear, because that's where you know my baby is fine. There is a tiny heart beating. So that is what we all hear. So usually the initial heartbeat will be double, triple your normal beating. So if you have 180, 170 beats. And then as baby matures, it comes down to, let's say 140, 150, around the time you deliver 120. And once they come out, they are back to like ours. So from 10, you would have seen, on scans, we always see the little limb buds, the little hands which come out, the little legs that can come out, and then they start moving as soon as they are like a little tadpole. They don't need to, they move like a little tadpole on that direction when you see on scan. But with limbs, they will start moving because they are in a huge pool of water. So they'll just kick and roll and move everywhere. So by 15, then you can see they will sense light. They know if something comes to the tummy or near tummy, they can sense the light, the sensation. So only after, so by 19, 20, they start hearing everything that happens. So I always tell everyone, you start talking to your baby by 19, 20 week onwards, because you will know the difference when they communicate. Some come and tell me the baby is more active when the father talks. Some come and tell me, no doctor, when I talk the baby is more active. Even your husbands are abroad, I always tell you, please tell him to talk just like he's talking to you, put a speaker on and tell him to talk to the baby. And some husbands have, even my patients have shown me songs that the daddies have sent from abroad and how much the baby reacts when the song plays. So even you will know when you talk, there is always some response. Somebody inside you will kick and say, I'm there, when the voice is very familiar. And you will see a massive difference when the baby comes out. I still remember when I finished the cesarean section and the lady wasn't just sleeping, so she wasn't up. But this father, I know him from the beginning, he would talk to the daughter. From the time, whenever we come, whenever I scan, he would always talk. The moment the baby came, he said the same exact things that he would always say. And you could see that she's communicating. She's saying in her own sounds that you know, she knows that I know you. Because especially the fathers are the ones who miss out most. So you start talking to your babies, you build your bonding when they are inside. Don't wait for them to come out. Don't feel shy. Because lots of people say, what do I talk, doctor? What is there to say? What can I say? You just talk your dreams. You say your day, everything. When you go out, you say, I'm going out. See you when I come back. When you come back, you say, hi darling, I'm home. That's it. Nothing else. So baby knows I'm a person and everybody is responding to me. Not only you, even your kids, even your in-laws, even your parents, whoever's home. Always make sure you have a bonding with your baby. So that bonding continues after. And the bonding is much stronger because you built it when they were inside. So that makes a big difference. All the fathers, do not talk to your babies. Only two, three. So do talk. What do you all talk? What do you talk? Stuff like what? Exactly. Our mommy is not irritating today. What else do you all talk? All husbands have big problems. What do I talk? What do you talk? Huh? So you can talk about your days, your frustrations, everything, and your dreams. What else do you talk? Tell me, what do you talk? Even the mothers, what do you all talk with your baby? Especially if you already have a name for your baby, call your baby by the name and you talk. So baby knows, I have a name. I have people, you talk about the dreams, how you want your baby to be, what your baby to be, everything and anything. You just keep talking. So then by that time they start drinking the water in their, that's amniotic fluid, the water around the baby. They swallow, they pee, they create more and more water, they swim around and you start feeling kicks just about, let's say, 20 weeks plus, but most first timers might not feel. You might feel at 24, 26 weeks. So it might take a bit time and you start putting on weight. Obviously, yes. And fathers too put on weight, correct? Because somebody said, one came and said, doctor, she eats half, then she vomits, I eat the rest and I finish it. So both of you put together. But some I know I have not seen putting on weight. Anyone else who has put on weight with your wife? Azra? Anyone else? No? You all don't eat half that your wife eats? You need to talk. I'm the only one talking today. So by little, when we grow, so obviously your baby's going to get bigger and you're going to get bigger, your husband's going to get bigger and life goes on. And when the end of the time, so at 37 will be your term. So the term is where your baby's complete maturation is finished. That's a term baby. After term, obviously your baby can come out anytime from 37 onwards. So it's 40 and the baby will come out. So that is how your baby will grow. From the time the fertilization occurs till the time they come out. So this video will show you how the things happen. So challenge is only for one sperm. So it rolls from the fallopian tube and comes into the uterus. So you can see the nice hair-like things along the cushion tubes. That's a fertilized embryo goes in. So this is when we see on scan the limb buds, the heart beating, the form of the baby. So that's when the time comes for delivery. So we'll talk about it anyway. So it's a cervix, water bag breaks, comes down, and then they get ready for the journey of coming out. And when they are out, then obviously we help them to come out. So this is the journey you would prepare yourself for. Yeah? So that is how your pregnancy is going to be. In simple few minutes, that's all. But what you prepare is for months. And obviously, your memories are for life. So you will create nice, beautiful memories the way you want your pregnancy to go, so you can cherish them forever. So the next one is about how you will start. I need some answers, please. So tell me what happened when you first found when you're pregnant. What did you all do? What did you do? What's your first reaction when you found out that you're pregnant, Azra? You're the one in front. Huh? What's your... What else did you do? Screamed, shouted, cried. What did you all do? She booked an appointment to see me. What else? Komadi? Rebecca?
Worried.
Huh?
Started worrying.
Started worrying. What else? What's your first reaction when you felt pregnant? Sollunga. What did you do? And even husbands, not only wives, I want from everyone. Aitan, what's the first reaction? You cried. All day. Anyone else? Sollunga appa. Huh? Shocked. What else? I'm going to just call out names now if I don't get answers. What did you do? Nice to see you. So what did you do when you first found? So you should give a lecture to everyone. We've gone through this. We've delivered 2 weeks ago, 3 weeks ago. Done, dusted. We are here to learn for the second time. What did you all first do when you knew you are pregnant? Happy. Happy? Subodhan. And pray. So all of you will have your own little things. Some of you would have been so happy, so shocked, cried. Anyone went on Facebook, Instagram? No social medias. So you people, I was Googling yesterday, my God, people do the mad and craziest things when they are pregnant. And I like the picture in the middle. Only child expiring December 11th. So that is another child who would think, like I was telling you, when they think, I'm the only one and now somebody else is coming. So obviously you will have some sort of an announcement. You might try, you might find a doctor, you wouldn't know what to do, you don't know where to go, you might call your parents and say, I'm pregnant, what do I do next? So it's like you will have lots of emotions. You will start worrying, you will start crying, you are more happy, you don't know what to expect, what is going to come next. So all of you would have done so many things. So like you said, yes, you will first think, who do I go to now? What do I do? Do I scan? Do I do blood test? Do I do what? So when you first come to a doctor, or what happens usually? What is the thing you would talk about? What did you all talk about? Your fears? You were happy? So when you come to first see me, obviously I will talk to you about your background, about your height, your age, your weight, because everything matters when you start off in your pregnancy. Your BMI, your current weight, because you might be someone whose average normal weight of, let's say, 55, 60 kilos, or you might be someone who's 100 kilos already. So I need to plan in my head, what do I do next now? How do I advise you not to pile up more weight? I need to tell you the risks of having extra weight in pregnancy, what things can go wrong, what to eat, what not to eat. So even if your BMI of 15, I have someone who's about 35, 40 kilos, 35 or 34 kilos. So that's complete opposite to someone who's 100. So I would think, my God, you're so skinny already. Would you? And there are people who never put on weight in pregnancy. They are saying 35 when I see, and maybe they are 37 when I deliver. So everybody is very different. You might have a background of other problems. So lots of things I need to know when I see you for the first time. Some people come and see me before they fall pregnant so that they can have a chat. So that's pre-pregnancy. You're going to have a chat with me to say, I am on these medications, what medication should I take? I have diabetes, I have blood pressure, I have asthma, I have depression, I am on all these. Should I fall pregnant? Should I not fall pregnant? So that is a chat we will have before baby. But some no. Most people I see them after you're pregnant. You will come and tell me, doctor, I'm on this medication. Even recently I had one who was on thyroxine and she suddenly stopped everything a month ago before seeing me because she thought it's going to harm her baby. No, you should not never ever stop whatever medication you're on until you see. But you make sure you see someone sooner to know, one, whether your medication is correct and that you can take it in pregnancy, whether it has effects on you and your baby. Some medications obviously have direct side effect, direct malformations on baby. So you need to know. Most of them you don't stop. If you're on thyroxine, you don't stop because your thyroxine is more important for your baby's growth, brain growth, baby's IQ and everything. So you're not going to stop it. Some people are on antidepressants. Sometimes you might wonder, it might have some harm, but the majority of the time I would think is my mother should be first well and then the baby comes second, always. So you can be on antidepressants, you can be on anticonvulsant for epilepsy, you can be on many drugs. But everything has its own goods and bads and risks. So we assess what is good and bad depending on the mother, how the control is, how many times she has had a fit, how many times she had a difficulty, wheeze and all that. So everything depends. So if you know, or if you know someone who's on medication, who's pregnant, obviously you go to a doctor and see them fast. Change your diabetic medication to pregnancy-friendly ones. Change your blood pressure medications for pregnancy-friendly ones. So these you will have to do. That is what I would think when I see you first. At the same time, some are told not to fall pregnant, but still they do fall pregnant. Some patients I have who would have had a kidney transplant, who would have had a very bad heart condition where you have blood pressure in the heart and you were told not to, pulmonary hypertension, pressure in the lungs, you are told not to fall pregnant. But still some come and tell me, no doctor, I want this baby. I do not want to do anything. I don't care whether I die, but I still want to be pregnant. So those are the difficult ones. So those are the people who will come and tell me, I don't care whether I lose my kidney, I want my baby. Some people will come and say with severe heart condition, they know they can't bear a child and they were not told not to. But still they'll fall pregnant, come and tell me I'm pregnant. So these are the things ideally, because it's about pros and cons and what do you want and what you don't want. So those are very difficult for me to say don't fall pregnant, but obviously it's your right. But as a clinician I would always say you were told not to because it's going to harm. as we go along, I will talk to you about the changes of the body that your body will go through. Then you will understand why I will say don't fall pregnant because your heart is too weak or your kidney is too weak, it can't handle. So those things will come along. And obviously screening initial blood, all of you, most of you, almost all would have blood tests done to check your iron levels, to check your blood group, to check your sugars, to check your infections, because all of them have implications on you and your baby. All of you would have had a scan to know where are your babies, how many babies are there, how many weeks are you, and is the heart beating, babies is right size. All these are general things you would have in your simple first clinic. And then also I have put down as down screening. So that is something depends on a lot of things. Your body weight, your age, your background, whether you smoke or not, all these will affect your risk factor. So the risk is increased when you have other things. So again, those are tests again available in Sri Lanka as well, in most of the places where you can check for babies' genetic abnormalities. So you can either do a scan, check the baby's back of the neck, the amount of the water compared to the age. The machine will calculate and give a risk factor. So the risk factor will be either low risk or high risk. Or you do more sophisticated test called NIPT, where they will do a blood test on the mother, take away the little baby cells out of your blood, and they will give a 99.9% accuracy of whether baby has a problem or not. But again, that all depends on you, your beliefs, your culture, your background, everything. Some people believe whatever God gives is God gives, I will take it. Some want to be prepared and say, no doctor, I want to know. Sometimes I would say, no, yes, you can do, this is your option, but especially when you're 45 and above or 40 and above, you ideally should do, because then your risk is much higher. So all these are obviously options available. And you will start, most of you will start folic acid either soon as you know you're pregnant or at least couple of months before you are planning to fall pregnant. Lots of you will be on iron tablets, calcium, vitamin D, and almost all those simple vitamins. So this again, the same fetal growth I was explaining to you on a scan version. Damit Dani.
Only 2 cells are needed to create a baby. 2 cells and a miracle. In just 9 months, this pair of cells blossoms into billions of cells. Gently nestled and protected in a mother's womb, a tiny human thrives. Together, mother and baby share this journey of life, this magnificent adventure called pregnancy.
So that's the initial 5 weeks or 4 weeks when we see. 6 weeks you can see the fetal pole with a tiny heart beating, and you can see it's growing. Now the limb buds are coming just like I showed you before. They're moving. You can figure out the facial features, the movement. 12. You can see the little fingers, the rib cage, the arm, the elbow, everything. So these are 2Ds, and you get 3D and 4D pictures afterwards. So you can see more features of moving baby. That's the 2D version, grayscale. chubbier movements. The fingers, all the features. You can see the tongue moving in, out. 39, 40 is almost ready. It is out. Scanning. So I have few who would come and say, "Doctor, please don't scan. Something will happen to my baby." Do you think any harm is there in scanning? Scan is only sound waves. So it's not radiation, it's not X-ray, it's not anything. It's just sound waves going through from the probe to the baby. So there is nothing. There are. If you go into Google and if you Google all that, they will say little vacuolation of the cells. All those are extremely rare and extremely too little that it's never mentioned anywhere. So there's no direct harm to say that scanning causes any abnormality in any baby in the world. There's nothing like that. Even if it's 2D, 3D, 4D, nothing. So scanning doesn't do anything. So normally, when you would have scans, one to confirm that you are pregnant. So that's your viability scan. So know that you have a baby in the right place, baby has a heartbeat, how many weeks you are. Then obviously you will have another scan around, let's say, 10 weeks, 12 weeks to know that your baby is dating. So you will have your dating scan to date your pregnancy. Then your next scan will be around 5 months, what we say anomaly scan or structure scan, to know that baby's organs are rightly formed. So if there is a problem, we can intervene, we can prepare, or just to know that everything is formed well. Usually, most people would do another scan at the end of the pregnancy to know the size of the baby or the growth of the baby. So all these are usually done, but different people are different. Some people scan less and more, but generally that will be your scanning routine for your pregnancies. So like I was telling you, so that this is how your pregnancy happens. That is how your baby is going to grow. So now what will happen to you now? So if your baby is going to grow from inside, obviously you have a placenta, you have a tiny baby, see, things will change. You're going to produce hormones. Your hormones are going to change you. So you will have changes. Your body function will change fully. How your body will function will change. How you will react to those hormones will change. And even physically, psychologically, you will change. Everything will change. So if you just think for a moment about how your changes happen, everything. The first thing you would have noticed is your period stops. Yes, that's how you would think, okay, maybe I'm pregnant. Then what is the next thing you all noticed? What changes do you first notice in you when you felt that you thought, I'm pregnant? Vomiting. You started to puke from day one. Anything else? Anyone felt tired? Eternally tired. You sleep every day for hours, but you wake up anyway tired. What else? Boobs hurt. Agree. Your boob starts hurting. You're so sensitive. It's so sore. You hate your husband coming close. Even the shirt touches, you hate it. So it's just sensitive. Some people start leaking milk. For some it's very sore, it's very sensitive, you can't even dress anything. And obviously you will notice your boobs are getting much, much bigger. Because one, it's retaining water, you have more fat cells coming in, you have the mammary glands growing so that they can produce milk. So your body is getting ready for pregnancy, getting ready for feeding. What else? Some action, something? What else? Husbands, what did you notice in your wife? The first changes. Headaches, yes. Frequent, constant headaches all the time. Irritated. What else? Angry? Yes, all the mothers are nodding. Husbands felt the anger, the rage, the irritation. So you will have all that. You are going to be angry. You will cry for no reason all of a sudden. So your body is changing. What else it will change? The other changes, apart from your psychological, other body changes, what else did you notice? Huh? What else? Yes, always you are going to the washroom. So everyone, so it depends. Some people from day one you'll be going to pee all the time. Some, the bigger you get, you'll start peeing all the time. So your bladder frequency is too much. You are going in and out of the toilet all the time. What else? Nothing? What else? In your wife. Heartbeat, yes, your heartbeat is more faster than normal. You feel your heart is racing, it's pumping, yes, palpitation. What else? Can you breathe? It's difficult. Most of the time you feel you're short of breath. If you talk a long sentence, you're short of breath. You just climb a few stairs, you're short of breath. So you feel there's something different in your heart. Breathing, your lung capacity, everything. What else? Huh? Yes, there are lots of cravings. My husbands are the one who suffer most because of the cravings. They go out at 2 o'clock, 3 o'clock looking for kottu or cheesecake or something or the other. Then they come and say, doctor, you don't know, if I don't take her a box of chocolates and donuts, I am never allowed into the house. So there are lots of cravings you just give in and you come and complain, my wife is getting bigger. But the person who feeds ultimately you. So the cravings will start. Some do have very funny cravings. I have had ones who would eat rice, sand, bricks, everything. So different people have different cravings and they can't stop. But those are things you crave for. Some crave for achar, that's a common, it's want something spicy. What else? No, nothing else you notice. If I ask more, heartburns? Yes. So lots of you, whether you eat or don't eat, sometimes you feel heartburning. You feel something's stuck here, something's not right. So nausea and vomiting. What do you normally do when you start vomiting? Because I have had some who would just stay at home thinking it's normal. Yes, vomiting is normal, but you can't let vomiting take over you. Because sometimes you start losing weight. Sometimes you stop or reduce going to the toilet. Or it's so dark, it's like you're passing plain color urine. Sometimes you're sleepy all the time. So these are danger signs. You can't stay at home. And there's nothing wrong in taking medication or IV fluids for the vomiting. It only helps you to go with the pregnancy. It doesn't harm your baby. I get so many who come and say, doctor, I was told at home not to take medicine, not to stop vomiting. Because if I stop vomiting, something will happen to my baby. And the same vice versa. They think if you don't vomit, you don't have a healthy pregnancy. Some of you, I'm sure, would have never ever vomited. But that doesn't mean your pregnancy is bad or something's wrong. Everybody will have different symptoms. Now, nobody will have the same list that I'm having here. Some will have everything, some will not have a thing. They will be just normal as always. So then if I move on, these, yes, all of you have. All of you have little trees growing from everywhere. Not only on your tummy, on your thighs, on your breasts, on your armpits, everywhere. So these go. Can you get rid of them? Somebody told me, if I knew I will have stretch mark, I will never fall pregnant. Huh? Will it go? Would you ever get rid of it? All of you have, most of you have stretch marks? Still have no stretch marks. So most of you would have, some people have from the beginning, some at the end. But some have no stretch marks whatsoever. That's the way your skin is. But most of you will have, and it start itching everywhere, all over the body, including your stretch marks, everything. And this black ugly line in the middle. Yes? Linea nigra. Do you have that black ugly mark in the middle? So all these are changes you will have. So in one way, husbands will think, I'm sexy to have my wife like that. If you think the other way, oh my God, look at her tummy, then it's a problem. I have husbands who come and slowly ask, doctor, do you think that will go or it will stay for long? Obviously you're going to change. You're never going to be the same person. You will change. You are never going to be the same 25-year-old who married 6 months ago will not be the same person who delivers the baby. And even after you deliver the baby, you will have changes. You will have lots of changes. So that is what you need to expect and accept, the two of you. So that it will not be a problem at all. You look at it as a nicer thing to say, my wife is a mother now. Hence she will have all these changes. Stretch marks are there most of the time for life in most people. Yes, it might get lighter. You might not see them after some time. In some people it becomes very light. Obviously you can do treatment and get rid of it later. But majority of the time you will have it. But you can prevent yourself by applying creams or applying some sort of a moisturizer to keep your skin very moist. So it is soft all the time. If you start scratching, they become more darker. So keep it very moist as opposed to being dry so you can save your skin. So these varicose veins. So sometimes you get little veins popping up in your feet, in your calf, and you have this red spot, black spots, all these spots all over your body, little hairs sticking out, lots of pimples on the face, on the back, everywhere you can name it, you will have. So you practically will change the way you are when you're pregnant. But that's how it should be. But again, I tell you, I have very rarely, I have couples who can't tolerate this change. I have wives who will come and tell me, doctor, my husband is always telling me I'm fat. He's telling me I have got ugly. Even I have women who will come and tell me, doctor, look at me, I'm so ugly. I used to be so pretty. They show me pictures of their wedding photos and say, look, I was so pretty, then look at me now. But again, this is something you are going to expect how the changes are because of the hormones you have, not because of anything else. Most of you will go back to your normal self, normal everything, if you work for it and if you do what you need to do. Not that you become ugly. But I have very rarely, I've had couples who have separated because the change is too much. The husband thought she's just too ugly. So you need to understand as a couple, this is what's going to happen to me. This is how we change. This is how my wife is going to be. But doesn't mean that's the end of it. That's again in one sense, yeah, she's becoming a mother. That's about it. So all these you will have. So like I was telling you, your blood volume will increase. The pumping blood, you normally have like 5 liters of blood. By the end of your pregnancy, your liters have increased. 6, 7, sometimes even 8 at the end. So you imagine the amount of work your heart is going to go through. So you need to have a proper functioning heart to go through pregnancy to withstand the extra workload. So sometimes I tell you, if someone tells me, doctor, I was told not to fall pregnant, is because obviously your heart can't take it. Same blood volume will go through your kidneys, all your organs. So all your organs will practically work double, triple the times that they used to work like before. So if they are not functioning 100% when you are pregnant, when you end your pregnancy, they will function much lesser. It's going to affect you, your life, your everything afterwards. So that is why when someone says don't fall pregnant means your body should be able to handle the pregnancy and the changes, the volume. So your peeing, even your shallow breathing, what happens? Your uterus is going to grow and your diaphragm is going to squash and your lungs are practically squashed up. So you're always short of breath. You have to take a short of breath. You're short of breath because everything is pushed and you're breathing much faster than before, but very shallow, quick breaths. So all this will change. Your stomach is practically pushed here. So even if you eat little bit, you feel, Allah, I can't eat anymore because it's so much full. And acidity comes up the moment you eat. So all these changes will give you everything. And this famous is your ligaments. Every joint in your body is going to ache. Agree? Everywhere is aching and hurting. Starting, some people come and say, even my nail bed is hurting. Everywhere will hurt. So that is why you need the support of your husband, your partner to say, yeah, I do understand. I empathize with you. Let me massage you. Let me do something. But yes, you are correct. You will hurt because you have hormones which are going to soften your ligaments. All your ligaments will soften up. All your joints will start aching. All your muscles will ache. But then all these can come. You can overcome these by being more active as opposed to not being active. So when the physiotherapist comes, she will teach you exercises. The more you are active, the more you are flexible, the more you stretch yourself, you can overcome all these issues. Not that you can't. So again, like I told you, your body weight slowly will increase, partly because fat, partly because you are retaining water. Obviously, you are getting bigger and bigger. Then your posture will change. You won't walk the same way you used to walk. You are different now because your belly is getting bigger and bigger. and organs and everything I've said. And also a lot of people have this numbness of fingers, yes? Because water retains and there's a nerve here which gets compressed, and you always will say, doctor, I can't feel anything. It's just not like before, it's very different. So all these changes happen when you are getting, so that posture will completely change. So initially you might be just straight as always, then eventually the bigger you get, your posture will change according to your baby. So all the other things, a lot of people come and say, I feel cold, doctor, my wife is too hot. Because your metabolism is high. Your metabolism, your producing heat is more high because your baby is demanding. So cramp, the itchiness, the bleeding, the dizziness, the tiredness, everything most of you will have. Some of you might not have a thing. But still, all the things that I'm telling you are normal. Unfortunately, obviously they're normal because they're changes of pregnancy. They are not abnormal. A lot of people will have constipation. You might not go to toilet like before. As opposed to peeing all the time, you might not pee at all. So again, because of the hormone changes, you will have problems. So this is what I always say, because like I was asking all the husbands, you are mostly irritated, mostly angry, sometimes crying for no reason. Then you need to understand something is there. I have ones who are depressed during antenatal, during the pregnancy. Some I have after delivery they are depressed. So all these changes will happen as long as you have support. Recently I had a couple who came and said she already had a history of depression, but now the stress at home is too much. Stress from the husband, stress from her in-laws, stress from their business, everything is just too much. She just can't handle, she's crying all the time. So you need to identify each other, especially husbands and whoever's with the pregnant women at home. You need to know what is a normal behavior, what is a normal personality. Has she changed? How is she coping? If you feel she's crying all the time and you can't handle and she's not coming out of it, something's wrong. The normal people will bounce back as your weeks and months progress. You do get better. You do feel happy again. Sometimes some don't. So if that happens, you need to identify and think, she's not the same. She has changed. I always tell this story to every single class I have. Once I had a 24-weeker who would come and told me that she doesn't want this thing there. That's what she referred to the thing. Because that thing has changed her body. When she looks in the mirror, her tummy is there and she looks so ugly. When she's in the bathtub, she can feel her belly out. So it's so ugly that she doesn't want this thing. She wants the thing out of her body. Because she was so depressed, she's about to even do something to get that baby out because she looks so ugly. So these are the things, rare things, but they can still happen. All of you would go through and think, look at me, I used to be so slim, I used to be so in shape, but I've changed. But that change is a good change with the baby. As long as you accept, you understand and see, okay, I'm changing. But doesn't matter, I'll have my baby and I'll go back to my original shape. But then sometimes it goes out of hand. Sometimes some husbands can't handle it at all. They also feel, my God, these changes are too much. My wife is too angry all the time. I have all the things I tell you are things I come across every day. I've had one or two couples who did divorce halfway through pregnancy because they were constantly fighting. Constantly from day one till I saw them and until the husband disappeared halfway through, they divorced. When the baby was out, they already divorced. Simply because it changes, neither of them couldn't handle. They were blaming each other. She said she doesn't understand and he says she doesn't understand. No matter what you say, they went for counseling, they went for everything, but nothing worked. Because it's just something that neither of them could handle at all. So these are rare, but I do get those couples. Majority of you will go through these changes smoothly and you'll come out of it smooth. But those are the things that you need to be aware, things can happen. So all these things, like I said, your journey starts very differently. Some of you will be so scared till the baby is out because you don't know what will happen. Some of you will be so scared till you pass 10, 12 weeks because you previously had a miscarriage. So your emotions are very different to someone who just felt pregnant and being so happy. Some people lose their babies at 37, 38 weeks. And until they deliver, they are like walking on pins. They don't know what will happen. So all these emotions are very different to every single one of you. So always I tell you, it's your unique journey. Don't even compare with anyone. What you feel is your feelings because of your pregnancy, your background. Go with the flow and see how it is. As long as you both support, you'll be fine. So again, lots of people have expectations. I get this, I want a girl doctor, no matter what I want a girl. No matter what I want a boy. How do you do that? It's very difficult. I have ones who were even depressed after knowing that they had the opposite sex they wanted. So those are the things that's very difficult because it's out of your control. But you're so fixed in your head. All the family has boys. I don't want a boy doctor. I only want a girl. And there comes a boy. And then everybody's so disappointed. So things you never know what will happen in your labor, what will happen in your pregnancy. So you need all your emotions to reflect what happens around you. Between the two of you, around your extended family, your friend circle, and obviously the country, everything will matter. But your immediate surrounding dictates a lot how your pregnancy goes and your mood changes. This is a very secret question I get from most husbands. Yes? Can you have sex in pregnancy? Can't or can? If you say can, hands up please. Can. Not even half the room no. Can or can't? Huh? Only this side can, the other side can't. Is it? Can or can't? Or should or shouldn't? Should you have sex in pregnancy? Should? Is it a must to have sex in pregnancy? Because I get questions. A doctor, I was told I have to have sex or else I can never have a normal delivery. Is there any truth in it? How many husbands are out of the room or out of the bed? Because you irritate them so much. Be truthful, please. How many of you are irritated so much you chase your husband out of the room? How many there are lots of people here who would say, I only want my husband to just touch me, just a cuddle, just a kiss and I want to sleep. I don't want anything else. Yes? Agree? Yeah, I can see all the face, I won't say names. So you only want him to just say, I love you darling, let's sleep. That's it. But some will say, Allah, doctor, I don't want him at all. I don't want him to touch me. I don't want him to talk to me. I don't want him to turn towards me. I want to sleep. So everybody is going to be different because that's again your emotion. There is nothing in pregnancy which to say medically you can't have sex at all. Obviously you can. It's a natural thing as I told you before. Unless medically it's contraindicated in pregnancy that you can't. But women are very different. Some women in pregnancy, they love sex more than normal days. So that's perfectly fine. You do whatever you want. Some hate husband, some hate the word sex, some hate the touch, some hate everything. So you need to go how your relationship works. Sometimes I have these poor husbands when I saw someone 1.5 years after I delivered. And I said, well, they came for something. I said, what is the contraception? You're not going to have a baby now. Ani, doctor, from day 1 till now, we haven't done anything. So why do we need contraception? 1.5 years, huh? For what? Because either they are too tired and baby is right in the middle of the bed. So easy contraception, no sex, no nothing. So you will be surprised at things I hear. So there's nothing called you have to. Because some come and say, doctor, everyone is telling me at home to have sex or I will never have a normal delivery. There's nothing like that. People think the vagina has to be opened every time to have a normal delivery. No. Normal delivery has nothing to do with sex. You don't have to have sex to have a normal delivery. Intimacy is something you will create among yourselves. What works for you? You like a kiss and a cuddle and sleep? Do that. You want more than that? Go for it. But there's nothing that you have to do. Women are compelled to do just because they think they will have a normal delivery. No, nothing like that. Nothing at all. But sex helps, yes, in achieving a normal delivery if you can do it. Because semen produces prostaglandin. Obviously, you can have a natural delivery. It might stimulate you. Sometimes some studies say, yeah, your natural labor starts, so your length of labor can reduce. So you can have a quicker or faster labor. Those are nothing for me to say, yes, you have to. There's nothing like that. But there's no contraindication to have sex even in labor, in pregnancy. But you need to have some sort of an intimacy. That is what matters. Your love, your bonding has to carry on. You can't live like two separate strangers in the house and expect bond to happen between the two of you and your baby, unless you have other issues. So there's nothing called, you have to create some sort of a love. You need the intimacy and love to continue. You can do so many things when it comes to intimacy. It doesn't have to be penetrative sex. It doesn't have to be sex. It doesn't have to be kissing and cuddling. But there are lots of other ways you can share your love. You can share, you can express your love. Some women in pregnancy, they long to know that my husband loves me. I just need to know. Some come and say, I want him to give me the vitamin, or I won't drink it. But there's nothing wrong with that. Why not give the vitamin to her? She just wants it. But lots of women change. You need to read your wife. What is it she wants? She just wants. I have had some couples who have given 1, 2, 3rd baby. I still had the same complaint. All 3 babies, same thing. Doctor, he doesn't spend time with me enough. He doesn't sit and talk to me enough. He doesn't do massages for me. He doesn't talk to me. He doesn't take me out. Simple things, not big things. He doesn't give me my vitamins. If he doesn't give, I don't drink. That's it. So all these things will change. So your love doesn't have to be sex. It can be anything. But you express your love, you build your love, your bonding has to carry on. So your bonding through labor, through pregnancy, after delivery is still much stronger. Or you are going to have rifts and breaks in between, which is sometimes irreparable. So this doesn't mean that you can't. You find whatever works for you. There is some intimacy, love, bonding, you carry on. So next one is, I think I will not talk about, oh sorry. So most of my women, so next one I will think about is, so those are changes that you would have in your bodies, your baby, your psychological, your physical changes when you're pregnant. Almost most of the time because of your hormones. But everybody will change depending on your relationship, your personality, how you both are, how strong your love is, all my emotions, everything I told you will change. So these are just other things that we will discuss today. So I think the nutritionist will come and talk to you about the things you shouldn't eat in pregnancy, how you can maintain your weight, all of that. But the famous thing I always get is eating butter. Do you know why? Anyone knows why you have to eat lots of butter in pregnancy?
The baby slips right out.
Huh?
The baby slips right out.
Exactly. Baby will slide through your passage and come out. So lots of my women have fed lots of butter and ghee. Please don't eat. Nothing will happen like that. Only you will get bigger. So little things you will hear, and some people say if you eat something, the baby will not have hair, baby will have itchy, baby will have rash. There's nothing like that. What you eat is only for you. Baby is going to get the minute nutrients from you through the blood, not the direct food that you eat. So things don't change a lot in your baby. And the other thing is the saffron. Yes? If you eat saffron, your baby is going to be much fairer, no? Will your baby be fairer? Lots of women are given saffron and milk. Full of does it? So again, saffron is obviously antiseptic. It's good for you, but it doesn't change the genetic composition of your baby. It depends on the two of you and your genetics. You are not going to have a fair, big baby just because you eat saffron. But all these changes you will, but anyway she'll talk to you about your other things. But these are things that I come across every day. And especially after you deliver, people will give you what? Kirikos. For the kiri to come. Kiri will not come. Only you will get bigger. So all these things you think, do you need extra food in pregnancy? Do you ever need? If you are someone who eats a normal, general, balanced diet every day before baby, do you have to change your food habits? Not necessarily. You can just carry on with the same food. But obviously you'll be more hungry. That's a different thing. You will crave a lot of things. But your food intake doesn't have to change. The quantity doesn't need to change. Your baby will just suck from you like a leech. Whatever you have, whether you eat, whether you don't eat, baby will still grow. Because you're providing from you, your stores. So baby will take everything from your storage. You don't need, but only at the end of the pregnancy, you will need more calories, so you will anyway consume a bit more. But you don't need to consciously eat for 2 people, eat for 3 people, drink double cups of milk every day. You have to eat cheese, nothing like that. You don't need to change anything. They are going to just change your body weight, nothing else. So anyway, when Shihani will come, Shihani will talk you through all the other things as well. And also we have a session on exercise. Hashim will go through, and then she will talk to you as well, so I'm not going to touch upon any of that. Pregnancies, yeah, most of the pregnancies have less or little problems, but you can have small and big problems. What problems normally would you come across? The scary ones in your early pregnancies. Anyone? The scary bit is, yes, you might bleed at any point of your pregnancy, from day 1 to the end. You need to know why you bleed. You can't figure out why. You have to come and see. I always would say, it doesn't matter what bleeding it is. Either you talk to a health professional, find out whether they know, or you're scared, you come and check it out. Because bleeding is always a problem. Either you can miscarry, either you have an ectopic, either it's just an implantation bleeding. You will not know at all. So you will have to see someone for you to know. And then, as I was telling you about vomiting, some people think all vomiting is normal. No, you can have infection, you can have pregnancy-related bugs, you can have appendicitis, you can have gastritis, you can have a tummy bug, you can have a fever, flu. Anything can give rise to vomiting. So you need to know that your vomiting, the amount of vomiting is normal or not normal. So you can't just ignore all these. Piles and constipation, yeah, some suffer a lot. Some initially lose 5-6 kilos because they are vomiting and then they catch up later. And some of the medical conditions, like I was telling you before, blood pressure, diabetes, gastritis, reflux, asthma, depression, sometimes they all get worse in the initial stage when your body is struggling to manage and balance hormones. So those you need to be aware how to manage, how to tackle, what do you do. And very rarely and sadly, some people have abnormalities in baby. Sometimes you do have ectopic pregnancies and other complications. So those are the side that obviously nobody wants, but they always happen to someone. So later on in pregnancy again, you might develop diabetes. You might develop diabetes, blood pressure, you can have a big baby, small baby, all these problems. Some of you might not be able to walk at all because you have so much severe pelvic girdle pain, you are struggling. Some of you will never sleep at all. Your blood pressure might be going up, sugar is going up, and your asthma is so bad, you're having fits in pregnancy. All these things can happen when you are pregnant, even later, towards the time of your delivery. Some very rarely on crutches, on wheelchairs, because you can't even wobble or walk around because it's so much, it hurts. So all these changes you will have, including baby issues too, not that you don't. So the most important out of this is the one I have put about pelvic floor. So you need to take care of your pelvic floor when you're pregnant, when you're delivering, and after delivery. So that you will always have your pelvic floor stronger and stable. When Hasini comes to you, she will teach you exercises how to keep your pelvic floor intact when you are pregnant, after you deliver, because it has long-term implications. Even now, most of you will cough and sneeze, you might leak a little bit of urine. That is because you have a big belly, big weight on top of your pelvic floor. Pelvic floor is a muscle at the bottom of your bone. So the baby comes out, it comes down, and the baby comes out and comes back. So in some people it comes back fully, in some it doesn't. So sometimes it's sad. You feel the difference after you deliver because it's more looser, more saggier, more heavier. And then again you lose control of urine. Again you feel, I can't control, it's just leaking. Sometimes some people have prolapse. Even after one baby, I have patients who are prolapse where the womb has come down or the bladder has come down. So pelvic floor is a must that you are going to try to keep it so strong and strength-wise so that you will not have problems now and later in your life. So when she comes, she will teach you all that. So these are, come up in your pregnancy. What are the things that you would say, my God, if this happens, I will leave the office and I'll go home and take my wife to the doctor. So like you said before, it's simply bleeding. So any bleeding, sometimes massive bleeding is a big problem. If you bleed like a period means something is not right at all. You have pains, you anyway will have pains all the time. But if you have pains that are not going away for paracetamol or simple painkillers, it's not going, your tummy is getting harder, baby is not moving, all these will be your warning signs. Don't take them easily. Because always I tell you, I have some bad experience where patients will tell me, Doctor, baby didn't move for 3 days. And I get a phone call on the 4th day. And I said, why didn't you come? No, I thought the baby will move tomorrow or today or whatever, I drank water. Or they say, my appointment is tomorrow, so I'm waiting. No, if your baby is not moving, if there is a problem, you would not take it easily. Always remember, baby is you're the only indicator for your baby's happiness and health. You will be the first one to know before me, before anyone, that something is wrong with the baby. So if your baby is not moving at all, or if you feel the pattern of baby movement has changed, you need to be alarmed, something's not right. You have sudden tightenings of your tummy, something is wrong. If your tummy is getting hard, something is wrong. If it's not getting better, you suddenly leak water or urine, you don't know what it is, come to hospital. Don't stay at home and think it's going to get better. Because if you leak water and you haven't been to hospital means you have introduced infection to the baby's water bag. So you are going to have an infected or sick baby when the baby comes. If you don't feel something is right, you come to hospital. Fits and things, you will always know something. But I get mothers who would come and say, even last week I did a cesarean. The only reason was she told me that the baby's movements has changed. It's different. She didn't feel it was right. That's the only thing. She said, no doctor, CTG was normal, scan was normal, everything was normal. And she's 38 weeks. So the only thing she said is, I know doctor, something is not right. And I would believe her than any of my electronics. When I did the cesarean, the cord was wrapped around everywhere, the neck, the leg, the hands, everywhere. So if I had left that baby, I would have had a bad outcome. So always think, you are the best indicator. If you feel something is not right, doesn't matter who believes you or not. If something is not right, it's not right. And it's always been the case all the time when I have accepted my patients and said, fine, you're saying something is not right, I'll act according to that. Just even my scan is normal, even my CTG is normal, even everything is normal. If my patient says me, doctor, something. So always remember that. It's not always correct. So preparing for delivery, I think I have another lecture afternoon, so we'll do that. And even this, the one that scares everyone, we'll deal with it after lunch. So after your pains, after your delivery, and there comes your baby, no? Sometimes, anyone here has twins? No twins, no this time, no. So, So you can have twins and triplets and all of that, and your problems multiply more and more, and your emotions, everything will change. I like this picture because look at the husband after delivery. He's fast asleep and she's gone.